Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. So today's video is on thalassemia. This is an inherited blood disorder which causes your body to have less hemoglobin than normal. Hemoglobin enables red blood cells to carry oxygen, and thalassemia can cause anemia, leaving you fatigued. If you have a mild version, you might not need treatment, but severe forms can require regular blood transfusions. If you do have fatigue, you can choose a healthy diet and exercise regularly to deal with this. There is also a form of assisted reproductive technology diagnosis which can screen embryos in early stages for genetic mutations combined with in vitro fertilization. This can help parents who have thalassemia or who are carriers of a defective hemoglobin gene have healthy babies. This procedure involves receiving mature eggs and fertilizing them with sperm in addition to a laboratory. The embryos are then tested for defective genes, and only those with genetic defects are implanted into the uterus. Some babies will show signs and symptoms of thalassemia at birth, and others will develop them during the first 2 years of their life. Some people who only have affected one hemoglobin gene do not have thalassemia symptoms, but for those who do, the symptoms are fatigue, weakness, pale yellow skin, facial bone deformities, slow growth, abdominal swelling, and dark urine. Thalassemia is caused by mutations in DNA cells that make hemoglobin, which is a substance in red blood cells that carries oxygen for your body. Mutations of thalassemia are passed from parents to children. So hemoglobin molecules are made of chains called alpha and beta chains, which may be affected by mutations. So in thalassemia, the production of either the alpha or beta chain is decreased, resulting in either alpha or beta thalassemia. So in alpha thalassemia, the severity of thalassemia depends on the number of gene mutations you inherit from your parents. The more mutated genes, the more severe your thalassemia. Contrast with beta thalassemia, the severity of thalassemia depends on which part of the hemoglobin molecule is affected. So 4 genes are involved in making the alpha hemoglobin chain, and you get two each from your parents. If you inherit one mutated genes, you have no signs or symptoms of thalassemia, but you are a carrier disease and can pass it on to your children. If you have 2 mutated genes, your thalassemia signs and symptoms will be mild. This might be called the alpha thalassemia trait. And if you have 3 mutated genes, your signs and symptoms will be moderate severe. So inheriting 4 mutated genes is rare and usually results in stillbirth. So babies who are born with this condition often die shortly or after birth or require lifelong transfusion therapy. There are rare cases where a child born with this condition can be treated with transfusion and a stem cell transplant. With regard to beta thalassemia, there are 2 genes involved in making the beta hemoglobin chain. You get one from each of your parents. If you inherited one mutated gene, you have mild signs and symptoms, and this condition is called beta thalassemia minor. If you have 2 mutated genes, your signs and symptoms will be moderate severe, and this condition is called thalassemia major or truly anemia. So babies born with 2 defective beta hemoglobin genes usually are healthy at birth, but develop signs and symptoms within the first 2 years of life. There's also a milder form called thalassemia intermedia, which can result from 2 mutated genes. People with thalassemia can get too much iron in their bodies, either from disease or frequent blood transfusions. Too much iron can result in damage to your heart, liver, and endocrine system, including hormone-producing glands that regulate processes throughout your body. You can also get an infection. This is especially true if you've had your spleen removed, and in cases of severe thalassemia, bone deformity can occur. So thalassemia can make your bone marrow expand, which causes your bones to widen. This can result in abnormal bone structure, especially in your face and skull. The bone marrow expansion also makes bones thin and brittle, increasing the chances of broken bones. You can get an enlarged spleen. The spleen helps your body fight off infection and filter unwanted materials such as old or damaged blood cells. Thalassemia is often accompanied by the destruction of a large number of red blood cells. This will cause your spleen to enlarge and work harder than normal. An enlarged spleen can also make anemia worse. It can reduce the life of transfused red blood cells. If your spleen grows too big, you could get surgery to remove it. There's also slow growth rate, so anemia can slow a child's growth and delay puberty. You can also get heart problems, so congestive heart failure and abnormal heart rhythms can be associated with severe thalassemia. Children with moderate severe thalassemia show signs and symptoms within the first 2 years of life. So, if your doctor suspects your child has thalassemia, what happens is you can have blood tests done. So blood tests can reveal the number of red blood cells and abnormalities in size, shape, or colour. The blood test can also be used for DNA analysis to look for mutated genes. There's also something called prenatal testing, which can be done. So this way testing can be done before a baby is found. It's born to find out if he or she has thalassemia and determine how severe it can be. Tests to include this diagnosis of thalassemia for fetuses include chorionic villus sampling. This is usually done around the 11th week of pregnancy, and this involves removing a tiny piece of placenta for evaluation. And there's also amniocentesis. So this is done around the 16th week of pregnancy, and this test involves examining a sample of the fluid that surrounds the fetus. Important note that mild forms of thalassemia don't need treatment. For moderate to severe thalassemia, treatments can include frequent blood transfusions. So more severe forms of this require blood transfusions often. So this is possibly every few weeks. So over time, with blood transfusions cause a buildup of iron in your blood, which can damage your heart, liver, and other organs. There's also chelation therapy. So this is to remove excess iron from your blood. Iron can build up as a result of regular transfusions, and some people who don't have regular transfusion can also develop excess iron. Removing the excess iron is essential for your health. So to help rid of your body of the extra iron, you can take oral medications such as deferrisots or difeprifone or defloxamine. And defloxamine is usually given by needle. A stem cell transplant can also be done. This is also known as a bone marrow transplant. So this can be an option for some cases of children with severe thalassemia. This can eliminate the need for lifelong blood transfusion and drugs to control iron overload. This procedure involves the fusing infusions of stem cells from a compatible donor, usually someone such as a sibling.